Look at one of the first things is shin splints. Lot of people get affected with shin splints. Majority of them get affected with the posterior shin splints. At least that's been my experience working with runners. The anterior shin splints are basically because the bone is under stress and it tries to take the stress as long as possible, but when it can't, there's a little bit amount of swelling that develops within the bone, and that's the anterior shin splints. That's basically because of overloading, and when overloading is the problem, there's no other way but to rest it out. There are a few things that you can do concurrently when you have anterior shin splints or when you have a stress response from the bones. First and foremost, get your vitamin D levels checked. In my experience, most of us, if we do a blood test for all of us in this room, I would assume, well, almost all of us would be deficient in vitamin D. And deficiency is a big problem in our country despite being rich in the sunlight. So if you do get any kind of issues with your bones or even your muscles, where you find your muscle recovery is hampered, where from one training session to the next you don't recover, your muscles are still sore, one of the big issues could be vitamin D. However, if your vitamin D levels are normal and your bones are still aching, there is a stress response in your bone, then well, you've just been pig-headed and you need to cut back on your training and allow it to recover and then build it back up in a better way. The second most common thing that I have seen, in fact, I have seen posterior shin splints are far more common than anterior shin splints. Posterior shin splints refers to your tibialis posterior muscle. It's a muscle right next to your foot bone, and it becomes really painful. And one of the reasons for that is quite a few of us, even experienced runners who've been running for 10, 15, 20 years, their ankle either moves less or moves too much. Either of those cases will cause the muscle to pull. Okay, it gets pulled in the wrong direction and it gets very sore. A typical way to know whether you have posterior shin splints is people with posterior shin splints will also have their calves very sore. So if you have a shin splint and your calf is extremely sore, then it's usually the posterior shin splint. It has to do with the muscle and not really the bone. So the second thing could be anterior knee pain, which is pain in the front aspect of the knee. Either it could be just below the kneecap, which is usually because of the patellar tendon getting inflamed. That again is because of a loading response, that you've been slightly pig-headed and pushed your knee too hard. Or it could be around the kneecap, spreading onto the inside, which means there's a little bit of swelling under the kneecap, and that usually is because either your hip control is not normal, like your core and your glutes are not strong, or your foot and ankle is not moving right. So foot and ankle not moving right can actually give rise to posterior shin splints, anterior knee pain, extending right up to ITB syndrome, back pain. For running, it is important to know that if your ankle and foot mechanics is not right, it can cause knee pain, it can cause hip and lateral thigh issues. Otherwise, if the pain is not around your kneecap but just slightly below it on the patellar tendon, it usually means that you're loading your knee too much and you need to cut down on the volume and intensity and then gradually build it back up.